One of the most frequent questions that I'm often asked via unsolicited emails and so on and so forth, and also from many of my subscribers at my Applied Metabolics newsletter, is why is it so much harder to build muscle past the age of 40? Anybody who's been engaged in resistance training for years knows that as time goes by, gains slow down. It's much harder to build muscle past 40 and especially past 50. 50 is actually a turning point where certain changes in the body occurs, which makes it more difficult to build massive muscles. Now, I'm not saying you can't get in shape, because a lot of the questions I get in email and so on and so forth is, hey, look, I haven't trained in 20 years because of various obligations, work, family, etc. But I used to work out. I want to get back in shape. Would it be a waste of time for me to do so? Can I build any muscle? The answer to that is no, it is not a waste of time by any means. It's never too late to exercise. In fact, they did resistance training studies years ago at Tufts University in the Department of Aging, and they had these older people that were in their late 80s and early 90s. Now, a lot of these people were immobile. They couldn't walk without walkers or canes. They were very frail, and they put them on a weight training program, and the results were nothing short of amazing. Some of these older people were able to throw away their walkers. They were able to move around, and they gained a lot of the mobility and quality of life returned to these people. Now, I'm not don't get me wrong. I'm not saying if these people to continue to train at 92 years of age, they're going to be able to jump into the Mr. Olympia contest or even the senior Mr. Olympia contest. No. But what they're doing is they're maintaining their muscular system, their bone mass, their cardiovascular system, all of which bodes well for healthier aging that's free of disease and, of course, much greater quality of life, including the maintenance of brain functions, which is a big problem with older people, memory loss and so on and so forth. In fact, recent studies have shown there's a close relationship. I've seen, maybe dozens of studies in the last 2 years showing a direct relationship between maintaining muscle mass and strength and extended longevity. In other words, the more muscle you lose, the greater the chance of you dying prematurely from various causes, whether it's cancer, diabetes, heart disease, any kind of degenerative disease. In fact, and what happens is with the human body, you have to understand the human body is made to move. There's an axiom that says use it or lose it, and nothing is more applicable to that than the way the human body functions. Anything you don't use in your body, you lose. Whether it's brain cells, if you're one of these people that sits around, never reads, never tries to educate themselves, doesn't do anything to stimulate the brain, whether it's doing crossword puzzles or again reading or doing something that involves intellectual activity, if you do nothing more than, let's say, watch Netflix or sit in front of your TV for hours, your brain cells are going to it'd be like listening to popping corn. Pop, pop, pop. Those are your neurons gradually in your brain, gradually disappearing to the point when you get to be like 50, 55 years old, you can't remember where you put your keys because your brain needs oxygen, it needs blood flow, and that comes from movement. So there's no question that beginning exercise at any age is very, very useful if you want a healthier life and possibly, definitely increase longevity, unless you're unfortunate to get some sort of disease that cuts short your longevity, or you engage in bad habits like smoking, drinking, and that type of thing. But if you do everything right, exercise and follow a good diet, you can maximize whatever your genetic tendencies are. As a matter of fact, years ago they thought that your lifespan was basically determined by, it was determined by certain genetic patterns that you were born with, meaning there was not much you could do if you were born with, let's say, a certain death genes, if you want to call it that eventually will catch up with you and cut your life short. Previously, it was thought there was nothing you could do about that. It was like a ticking time bomb in your body. To a certain extent, that still holds true today, but In the last couple of years, a branch of science has emerged called epigenetics. Epi means above. So what that means literally is you can control your genetics by engaging in endeavors or activities that switch on and off certain genes, including genes associated with aging. In other words, you have the power to, even if you have bad genes for, let's say, longevity, you can turn them off if you do certain things, and among them is exercise. Now, regarding the question of having not trained in 20 years and coming back to the gym, what you have to do is if you train very hard when you're in your 20s and you did a lot of exercise volume, trained 6-7 days a week, whatever, don't try to do that when you come back to the gym at 40 or 50 years of age. You got to ease into it slowly. Start out with lighter weights. Don't push yourself. Take longer rests between sets, about 2 minutes to 3 minutes between sets. Let your endurance catch up and all that. In other words, to make a long story short, when you first return to the gym, take it slow. Don't try and push yourself too hard. If you do it that way, you'll gradually break into training. You'll be surprised. You'll gain a lot of muscle back, because there's a concept called muscle memory. Muscle memory involves, without getting too much into the technical aspects, it involves the development of new myonuclei, which are basically muscle nuclei that develop when you work out. And when you lay off and you don't stimulate your muscles, the muscles atrophy due to lack of activity. However, the muscle nuclei remain. They don't die off right away. And as such, when you begin training again, the myonuclei, which are involved in muscle protein synthesis and hypertrophy or growth, they kind of come to life again, and you gain the muscle back that you lost. This is what we call muscle memory. I mean, we've seen it for years, but nobody had a technical explanation for it until a couple of years ago when they found this effect of muscle nuclei. Now, if you haven't trained in, let's say, 20 years or more, your muscle nuclei are probably gone. They don't stay around forever. They only stay around for, let's say, a couple of months after you stop training. If you haven't trained a long time, so, what I'm trying to say here is you don't expect to get the same. If you were like a huge, big guy with 20-inch arms and a 60-inch chest when you were 25, and you haven't trained in 20 years, and you've gotten obese or skinny or whatever, don't expect to come back to the gym and in 6 months look exactly like you did when you're 25, because, buddy, it ain't going to happen. It's just not going to happen. Those myonuclei, they've waved goodbye. They're long gone. So that's not going to happen. But let's talk about some of the reasons. First of all, again, to answer the question in one sentence, is it worth coming? Can you build muscle after 40? Yes. Is it worth returning to the gym or beginning working out again when you haven't trained in a long time? Absolutely. There's no question about it. But let's talk a little bit about the common reasons to explain why in just about every human being, I don't care who you are, I don't care how genetically gifted you are, once you get past a certain age, it's much more difficult to build large muscles. And the same holds for sports. I mean, there's a reason why a lot of the elite athletes in the world, whether it's baseball, football, track, you name it, you'll notice that they retire. A lot of times we're in their late 30s as they approach their 40s. Why? Because they can't produce the same level of athletic performance that they did when they're younger. So this pertains even to the most elite athletes. Those age catches up with them. It's not that they fall apart, but they can't, let's say, compete with the younger people who have certain advantages because of their age. So let's talk about some of the factors that kind of limit the amount of muscle size you can build past the age of 40. Now, I'll start out by saying that, and speaking for myself, this is true too. I began training regularly with weights. I did calisthenics, push-ups, sit-ups, and chins starting at age 11, but I actually didn't start lifting weights formally till I was 12, and I've been lifting it since then, which means that's over 6 decades of working out. So I've seen certain changes in myself that apply to a lot of other people. Now, I'm not going to tell you I've ever been I was an elite champion bodybuilder. I wasn't. I won a couple of local contests. You could look up pictures of me in my 20s when I competed. I did pretty good. I didn't take any steroids. I think I did very well for a so-called natural bodybuilder. But I've continued to work out. This is the point I'm trying to make. I've continued to work out all these years, and I've noticed certain changes. Now, when I was 40, they say that a lot of the changes occur when you hit 40. However, maybe because of my consistent year in and year out training all those years, I didn't notice that much when I hit 40. In other words, I didn't see a lot of loss of muscle size. I didn't see a lot of loss of strength. I started to see a little bit of a dip when I hit about 46. Not much. I was still pretty damn strong at 46. I still could do 400-pound squats, that type of thing. The big changes occurred in me personally. I noticed a kind of a significant slowdown in muscle gains when I hit about 50, and it started to accelerate at 55. So for me, the magic number was 55. That's when things turned around. That's when the gains more or less stopped. No matter what I did, it didn't seem. It seemed like I couldn't make significant gains comparable to what I made when I was younger. For example, my legs, my thighs were always my strongest body part. I once made a bet with a guy in the gym that I could put 2 inches on my thighs in a month just by altering my training. This when I was about 24 years old. So he took the bet. What did I do? I went on a very heavy squatting program. I went up to 605 pounds for, I think it was 10 reps. And sure enough, I gained 3 inches on my legs in a month. In other words, my body was that responsive when I was in my 20s. Now, if I tried to put 600 pounds on my back today, right now I'm just under 5'11". If I tried to squat down with 600 pounds, by the time they pulled me off the floor, my height would be down to about 3'2". 3'2". I'd literally be crushed. And believe me, I'm not stupid enough to attempt something like that. Although I have to tell you, and this is just an aside, I see a lot of older guys, and I could tell, I don't know these men personally. I see a lot of older guys that are well over 50 going to the gym and attempting to lift very heavy weights, comparable to probably what they lifted when they were 25. And why are they able to do it? Because, and I'll put this bluntly, their form stinks. I saw an older guy looked like in his mid-50s. He was doing a machine bench press. This was his range of motion. Watch my hand. He had like 3 plates on each side, which is a good amount of weight, and he was moving the weight about 4 inches. That's not working any muscle. All that's doing is put a stress on the joints. And you could see by his body it wasn't working. He didn't have a lot of muscle hypertrophy. So in his mind, he thought he was doing something, but that's where it existed. It was delusional. It was only in his mind. And by older guy training in that manner is way, way more subject to injuries. It's very dangerous to try and lift more very heavy weights because, again, and I'll get into this in a minute, changes occur in the body that make the lifting of very heavy weights very hard and very dangerous if you're over 50. And a lot of it has to do with one of the factors that limits muscle growth past 40 or 50, 40 or 50, and that has to do with the changes that occur in connective tissue. Now, your muscle has connective tissue too. When people think about connective tissue, they usually think about joints and tendons, which is true. They're made of connective tissue. The difference between connective tissue and muscle has a great blood supply. That's why you get that great pump when you work out, the increased blood flow in muscle. But connective tissue has a very poor blood supply. That's why when you get a connective tissue injury, such as a joint or tendon injury, it takes much longer to heal because of the poor blood supply. It takes much longer to heal compared to a muscle injury. However, as you get older, the connective tissue tends to kind of dry out and stiffen. And when it dries out and stiffens, it loses strength. And when connective tissue loses its integrity, if you want to call it that, it affects muscle strength. You can't lift as heavy if your connective tissue is not aligned with your muscle strength. And you can't do it. And that's one of the reasons why you can't lift heavy when you get older. And if you can't lift heavy, it's harder to affect the type 2X muscle fibers that are most amenable to growth. These are the muscle fibers that are affected when you lift very heavy weights. It's much harder to kind of tune into them when you're past 50. That's one of the reasons why it's harder to build, larger muscles past the age of 40. Now, I'm not saying you can't build muscle past 40. There's ways to do it. You just have to work around, let's call it nature's challenges to building muscle. So let's look at some of the factors that make it harder to build muscle at past 40. One of them is called anabolic resistance. What that means is a lot of causes for anabolic resistance. Probably the main cause is being sedentary, not working out. It relates to what I said earlier about use it or lose it. If you don't work out, your muscles kind of disappear. That's the way it works. And it has to do with also neuromuscular activity, which I'll get into in a minute. But the point being that your muscle increases the uptake of amino acids only when there's a stimulus to do so. If you don't work out, the need to increase amino acid entry into muscles declines. And that eventually, the anabolic resistance that's results could lead to a condition called sarcopenia, which is an age-related loss of muscle. That's one of the main reasons why people wind up in nursing homes and become frail and can't walk and all this kind of thing. They also lose their mind and But what can you do about anabolic resistance since it's one of the factors that hinder muscle growth past 40? What you can do is, I'll tell you right now, if you're past 40, you have to increase your protein intake. They've done studies. Young men, they give them 25 grams of protein per meal. They get increased muscle protein synthesis. You give about the same amount to a man over 40, not the same. And again, it's due to anabolic resistance. And this is men who did work out. So they only had a minor degree of anabolic resistance, but they still could not take up the amino acids in muscle comparable to, let's say, men half their age. So what you have to do to make up for it is you have to increase your protein intake. So if a young man takes in, let's say, 25 to 30 grams of protein per meal, an older man needs to take in at least 35 to 40, even as much as 50 grams of protein per meal. And you want to focus on, you make sure that you have at least 3 to 4 grams a day of a particular branched chain amino acid called leucine, because leucine is the most pivotal amino acid involved in the muscle protein synthesis process. It has to do with something called mammalian target of rapamycin, or mTOR. I'm not going to get into that in this video because it would go too long. Suffice to say that leucine is a very important amino acid to help you keep muscle past the age of 40. But you still have to have all the essential amino acids. Leucine doesn't work in a vacuum. You have to have all the other 8 essential amino acids present for leucine to boost muscle protein synthesis, because all the essential amino acids have to be present simultaneously for muscle protein synthesis to succeed, or to proceed, I should say. But leucine is the key that kind of sets it off. It's like a fuse. It sets off the whole muscle protein. So the first thing is anabolic resistance. And by the way, working out along with resistance exercise, weight training, elastic bands, that kind of thing, that greatly reduces anabolic resistance, because now, but your body can detect that your muscles need more amino acid entry. So the kind of blockage of amino acid entry into muscle declines. So now your muscles can take up more amino acids than compared to a sedentary person. It doesn't completely change, though. The older you get, the greater the level of anabolic resistance. But if you keep your protein intake up, I would say maybe at least 2.0 to 3.3 grams per kilogram of body weight, most of the anabolic resistance, you can get rid of it. It's gone. It won't affect your muscle growth. Then you have other things to consider. I mentioned earlier the stiffer connective tissue. It's very difficult to get around that one. It just happens with age. It happens to everybody. There's not much you could do. But if you look at the basic cause, what is it about? What is the mechanism that causes your connective tissue to become so stiff? You see these old people, they could barely walk. They're very stiff. What is it? What causes that? Well, they think it's something called advanced glycation end products. This involves, it's very technical. I write about it in my Applied Metabolics newsletter. It would take a 2-hour video to explain all the nuances, but suffice to say that it involves the deposition of protein into of sugar into protein structures where the sugar deposition, for example, in connective tissue, the increased sugar deposition in the protein structures, mainly collagen and connective tissue, weakens the tissue. And as it weakens, you get that stiffness, and there's a secondary effect of increased oxidation with age. The body produces stuff like reactive oxygen species or free radicals that tend to attack cell membranes and also cause a weakness of tissue. So those are things. Now, there are things you could do to minimize advanced glycation end product production, such as not overcooking your food, don't eat fried food, avoid excess refined sugars. As far as oxidation goes, you could take some antioxidant nutrients, but when you work out, your natural endogenous antioxidant system, consisting of superoxide dismutase, catalase, glutathione, automatically goes up anyway. So just working out alone will go a long way towards minimizing the aging of connective tissue. But it does age, and you have to take that into account, because as I said earlier, if you have this stiffer connective tissue and you try and lift heavy weight, it's gonna rip like a piece of aluminum foil, and you're going to get an injury where you might not be able to train for months. It's not worth it. You have to work around this stiffer connective tissue, and I'll talk about that in a minute. Probably when you mention lack of muscle mass with age, most people, the first thing that would come to mind would be a deficiency of various anabolic hormones, and that's true. That's true. Men gradually, the production of testosterone in men starts at age 30. It drops about 1 to 2% a year, I think it's about 1 to 2% a year. Growth hormone drops 14% per decade, and along with growth hormone, you get a lowering of insulin-like growth factor 1, which very important for maintaining muscle mass, IGF-1, especially the IGF-1 produced in muscle. IGF-1 is produced in the liver and in muscle. The muscle IGF-1 is extremely important for maintaining muscle mass. So I'll get to that in a second also, but the point being that if your anabolic hormone levels are deficient, you're not going to be able to build muscle not only at 40, but not even at 20. There was a study years ago where they gave young men a drug, which these men were young, healthy men involved in resistance exercise. They gave them a drug that blocks testosterone, and men continued to lift weights, get involved in training. They made no gains. The other group that didn't get the drug, now these guys weren't on steroids, they were just a natural testosterone level. The other group of young men, these guys were about 25, the other young men that didn't get the drug and continued to lift weights made muscle gains. Only the ones that got the drug that blocked testosterone made no gains whatsoever. No strength gains, no muscle gain. So that shows you how important testosterone is for muscle mass. Now, a lot of older men ask me, what's the level of testosterone needed to build muscle? Well, if you go to a doctor, and unfortunately there's a big problem with doctors giving out testosterone. They're loath to do so because they believe a lot of these myths about testosterone causes prostate cancer, cardiovascular disease, all that stuff. But besides that, if you are lucky enough to get a doctor who does prescribe testosterone replacement therapy, he will give you usually like a cream that you put on. He won't give you the injections. There are reasons for that. I won't get into it here again. It takes too much time. But usually you get like a cream or ointment or something like that. These creams and ointments are designed to bring up lagging testosterone levels to what they call the midpoint of normal on the testosterone scale, which is about 500. It goes from, let's say, 300 to 1,000. So the goal is to bring you to the 500, which doctors feel will cure any problems associated with a lack of testosterone without causing problems related to too much testosterone. They're afraid to bring it up too high, because if you go above the scale, let's say if you go above 1,000 on the total testosterone scale, you're in no man's land. They don't know what that nobody knows the long-term effects of maintaining super high testosterone levels. They think there could be a relation between that and increased cardiovascular disease. But again, nobody really knows. But the problem with that is while having a testosterone of 500 is enough to cure a testosterone deficiency, it's not really enough to really build muscle for most men. Some men can build muscle on 500. Most men cannot. Based on my experience and seeing a lot of testosterone tests of men who are involved in exercise, my theory, and this is a theory, I have nothing to back it up, although I did read one study that kind of confirmed this, to build muscle in a man past 40, you have to have a testosterone level of at least 700 to 800. That will allow you to build muscle past 40. Now, as far as growth hormone, I'm not big on growth hormone replacement therapy myself. There's too many potential problems with it. But suffice to say that if you take a test or you undergo medical testing and you're low in, you're deficient in growth hormone and you want to take growth hormone replacement therapy, that's fine. Will it help build muscle? Not nearly as much as testosterone. However, growth hormone, as bodybuilders will tell you, growth hormone is synergistic with testosterone anabolic steroids. So growth hormone alone is not very anabolic, contrary to what you might hear. But when you combine it with testosterone or anabolic steroids, it suddenly does become anabolic. It adds to the effect of the testosterone alone. So if you're deficient in growth hormone, you might consider growth hormone therapy. I've never recommended it myself for various reasons. A lot of it has to do with the expense of growth hormone therapy and this and that. But as far as the other one, IGF-1, this is like the main thing. The IGF-1 produced in muscle, it actually has 3 variants. One of them is called mechano growth factor. This, more than anything else, is associated with maintaining muscle with age. The way it works, muscle-produced IGF-1 stimulates the differentiation and proliferation of muscle stem cells called satellite cells. Now, I'll get to that later on, but I just want to leave off this particular area by just telling you that if you're deficient, if you're not making gains and you have some of the other symptoms of, let's say, low testosterone, depression, lack of sex drive, erectile dysfunction, increased fat deposition, especially around the waist, you might go to a doctor, have yourself tested for testosterone. What really counts, by the way, here's a little tip for you. Total testosterone doesn't really mean much. What you really want to know is what they call the free testosterone level. Free testosterone is unbound testosterone, because testosterone travels in the blood bound to sex hormone binding globulin. In other words, it's bound to a protein. It's not active until it disassociates from the binding protein and becomes free. Free testosterone means active testosterone. So, for example, let's say you're a man, you go take a test for testosterone. Your total testosterone is, let's say, not that great, 400, let's say, right? You're 50 years old, it's 400. But then, you ask the doctor to test for the free testosterone, and you have a good free testosterone elevated. You don't need, if you have a good level of free testosterone, and this happens occasionally, there's no need to take testosterone therapy if muscle building is your goal, because the free testosterone will be enough to build muscle. Very few doctors tell their patients that, but this is the truth. Another reason why it's hard to build muscle after 40 is you get what they call reduced anabolic signaling in muscle. For example, when a young man works out with weights, I think there's 150 genes that are turned on related to anabolic effects in muscle are turned on in a man under age 40. When you get past 40, there's only 42 genes turned on. And that means there's less muscle protein synthesis, there's less anabolic effects in muscle. So again, that's an age-related effect. The main, if you really want to if you really want to look at the main mechanism, most of these genes are involved in turning on that intramuscular IGF-1 that I talked about. So in the future, they're going to have a type of gene therapy. They already have done this in animals, where they're going to inject basically a virus attached to insulin-like growth factor 1 gene directly in muscle, which will completely regenerate the muscle. In simple terms, when they've given this to animals, let's say mice, rats, mice the equivalent of 75-year-old humans, that this gene therapy turned their muscles to look exactly like the genes of a teenager. In other words, their muscles went from 75 to 19. Now, I'm not saying you should go out and run out and try and get gene therapy because it's not available anyway. But the point is, it does work, but they have to iron out certain problems, such as the fact that gene therapy can also cause cancer. So as soon as they kind of figure out the problems, iron it out, in the future, you will be able to build muscle at any age, even 70, 80 years old. If you want to build more muscle, it'll be a lot easier. I mention this only to give hope. Whether it'll happen in our lifetimes, I couldn't tell you that for sure, but I could tell you that it's here now. It does exist in animals. I mentioned another reason for a lack of muscle mass gains with age has to do with those satellite cells. These are muscle stem cells involved in the repair and building of muscle. Now, not every scientist agrees with this. Some scientists. What's a scientist? That's a scientist that designs ties. No, some scientists think that the satellite cells are not necessary to really build muscle. They think it's overhyped. But the preponderance, let me put it this way, the preponderance of the research conducted over the last 40 years or so show that satellite cells really are involved in muscle building. As you get older, you can get a depletion of satellite cells. The less satellite cells you have, the harder it is to build muscle. A loss of satellite cells would be greater in people that have been sedentary for many years. In other words, if you haven't worked out for 20 years, and you start training at 50, 60, there's probably going to be a lot of depletion of satellite cells. The good news is that some recent studies show if you continue to exercise, you can replete, or you can actually turn on a lot of those dormant satellite cells, which will allow you to build muscle. Again, not to the extent that you could at 25, but you will be able to build some muscle. Another reason why it's hard to build muscle past 40 is increased body fat. A lot of people, as they get older, some of these people were real lean and cut or whatever, low body fat when they're young. Things happen. You get older, you get less active, you continue to eat the same amount of calories, same amount of food. You get what they call creeping obesity. You start to build, gradually fat accumulates on the body. Now, not only is this bad for health, but it's very bad and it makes it much harder to build muscle. Why? Because body fat or fat cells release over 100 types of protein called adipokines, and most of these are inflammatory. So when you have a lot of body fat on your body, you have a lot more of what they call systemic inflammation. It's not something you could feel, but systemic inflammation is the cornerstone of most degenerative diseases, including cancer, heart disease, brain degeneration. It's a very insidious process because you don't feel it. But the point related to building muscle past 40 is when you have a good amount of systemic inflammation, it's catabolic to muscle. It breaks down muscle. It's one of the main causes of sarcopenia, or the loss of muscle with age. That's the bad news. The good news is working out alone. One of the great things about working out, one of the reasons why it's really healthy, is it lowers systemic inflammation. That's right. Exercise alone will lower systemic inflammation. So if you can drag yourself to the gym and start working out on a regular basis, the inflammation will decrease. And of course, if you go on a diet, the diet is up to you. It varies with individuals. For me, it's a low-carb diet, but whatever diet you use, as you lose body fat, again, levels of systemic inflammation go down, down, down. The less body fat you have, the easier it will be to build muscle. So the last one I'll mention, because this video is already kind of long, is the need for increased muscle recovery. I mean, I don't care who you are. Some of the greatest bodybuilders ever, now that they're in their 60s and 70s, most of them have reduced their training frequency because they've noticed that they don't recover. You just don't get the same recovery when you're past 40 that you have when you're 20. Some of these young guys could probably get away with training 6-7 days a week. You can't do that for many of the reasons I discussed early in this video. You have to give yourself enough recovery time. What does that mean in practical terms? Don't try to train 6 times a week for 2-3 hours a day. You're not going to get anywhere. You're not going to build any muscle if you pass 40 or 50. What you have to do is use some common sense. Keep your workouts to 45 minutes to an hour, and maybe 4 times a week at the most, or even 3 times a week, whole body training if you can handle that. That's very good. My point being here, you got to give yourself enough recovery time. You got to give yourself at least 48 to 72 hours recovery for every muscle you train. So that's how you figure how often to train or how much frequency to use for the muscles. Now, the last tip I'm going to give in this video is if for some reason you've lost so much strength you can't lift heavy weights, and I've mentioned this in past videos, research shows if you lift light weights and do higher reps, like I'm talking 25 to 30 reps per set, but train to failure. You have to do them to failure. It takes a little experimentation. You got to figure out, what weight you will use to bring it to failure. If you train in that manner, the studies show, as far as your muscles are concerned, it's equal to using, as far as muscle growth, it's equal to using 90% of 1 rep max. In other words, your muscles get the same stimulation lifting lighter weights to failure as they do lifting heavy weights. If you lift heavy weights, you don't need to go to failure because you're already stimulating those muscle fibers I talked about earlier that are most amenable to growth. But if you're lifting light weights, you have to go to failure. You have to do higher reps because you have to build up something called metabolic stress in the muscle, which I discussed in depth in my Applied Metabolics newsletter if you're interested in how this works. I have an article, several articles about that in Applied Metabolics, but suffice to say, metabolic stress has to do with increased anabolic signaling, including opening up some of the dormant channels that I mentioned earlier that are closed with age, that will allow you to actually build muscle past the age of 40 or 50. Again, you're not going to get the same amount of muscle that you had when you're 25. Kiss that goodbye. I don't care. Somebody might, on the internet, sometimes you see photos of these older guys. I mean, they're gray, they're bald. I mean, you could say they're wrinkled. And, from the neck down, they look like they're 20. They're ripped, they're vascular. I mean, it's like they only age from the neck up. Well, first of all, most of these are photoshopped. They're not true. These guys don't look like that in person 9 out of 10 times. But there's always what they call something called outliers. There's always a situation where somebody, through freaky genetics or whatever, can actually maintain a lot of muscle and strength even with advanced age. At 60 years old, they could still be pretty big and strong. But I emphasize, these are outliers. It doesn't apply to most people. Most people, unfortunately, we have to obey or under the control of the laws of nature. And the old saying, you can't beat Mother Nature, holds true. So I hope you understand why it's a little harder to build muscle after 40, but you can do it. I'll leave you with this one thought. The one thing you want to do, more important than anything, is try and maintain muscle. I mean, even if you're not growing as fast as you want to, muscle size, and it is going to be hard. It's going to be very slow, and it might not even happen at all. But what you can do is maintain muscle. As long as you engage in resistance exercise, as long as you live, you'll maintain most of your muscle. And I'll leave it at that. If you want more information on nutrition, exercise science, anti-aging research you can use today, effective fat loss techniques, ergogenic aids, hormonal therapy, supplement science, which supplements work, which ones don't, women's health and fitness, many other topics. I cover more topics in Applied Metabolics than any other digital publication on the internet. It's written in English because I'm a professional writer. I've been a writer for 4 decades. I know how to write for the public. It's not written in medical journal style like these other digital publications. So subscribe today. It's 30 to 50 pages every month. It's like getting a monthly ebook. Subscribe at www.appliedmetabolics.com. When you subscribe, I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on exercise science, nutrition, medicine in general. I also answer questions from subscribers. You have to be a subscriber, though, to join my private Applied Metabolics page. I have an email portal, my Applied Metabolics web page. That's only for subscribers. Also, they can send me short questions, anything they might have read in Applied Metabolics, anything that comes to mind. I'll be happy to answer as long as they're short questions. And that's about it, I guess. So if you want to have the best friend you'll ever have, well, this is the longest video. I didn't expect this video to last this long. This, I think, the longest video I've made in years. But I hope the information is useful to you, and that it's answered your questions as to the dilemma of why it's so much more difficult to build muscle past 40. Take care, and thanks for listening. If you stayed this long, thank you.